So I think that really what has been essential to this process for us, certainly at the CEA, in terms of leadership, is we've been working very closely with the Commissioner of Education, and she has been excellent, I think, at the governor's guidance to be inclusive, to be thoughtful. You know, when the Omicron variant started to kind of push into our lives, we were meeting with her almost weekly, in communication almost on a daily basis, trying to figure out what are resolutions that could be applied throughout the state, really tracking that, working with the Department of Public Health as well. I mean, I think we're mindful in this process that we are not public health experts. So we are very strongly taking the lead of those people who are, you know, health experts in the field, which is why when we were told, listen, you need to upgrade the masks, we need to get these tests out, it really started to become a priority. But I think what you're seeing is that it's not perfect, right? There's going to be times where the governor are not going to agree. and the commissioner and I have even talked openly, like, listen, there are just going to be times. But more often than not, we're looking for that place where everybody gets what they need to be successful. And I think that's really been the driving point as we navigate all sort of the uncertainties, is what do we need to keep schools open, because that is a point of agreement that we have, is that the best thing we can do is to keep staff in schools, to keep schools open, to keep those kiddos in classrooms. But we need to do that with a commitment for safety and security. And so as we started to see the surge, you know, getting these masks out, I mean, that was not without bumps in the road. And we know that obviously we took a very critical stance that this did not happen with the expeditious nature that we were looking for. And I will also tell you that I'm not going to claim to know where the fault lies there. I know that there is a lot of places in the trajectory of getting things into the buildings. You know, and so we have to just be mindful to prioritize that as the conversations go. But I think the idea has been throughout this pandemic is that we all benefit when public health is maintained, when schools are open, and when communication is solid. And so I think a commitment to those things has been really essential from my standpoint in terms of coming out of this feeling like we're going to be strong, empowered school systems. Governor?
I think you said it.
Governor, question for you. Your counterpart in New York, Kathy, has said that she's going to let the school mask mandate expire soon. You've indicated you want the legislature to keep it going at least for a while. How long would you like them to codify it for, and why not let it expire like New York is?
I think it's a little early to make any predictions. We were just at a 25% infection rate 2 weeks ago. You know, my executive powers go through the middle of February. So we have, John, submitted 11 executive orders that we'd like the legislature to consider, to ratify, to reject, modify, but I think are very important to keeping our schools open, our businesses open, and doing that safely.
How long would you like the school mask mandate? I mean, obviously, they're not going to make it permanent. There's going to be a time limit. So what are you thinking?
I think the facts on the ground are going to tell us something pretty soon. If we find that Connecticut's like New York, which is like South Africa, and the infection rate goes down pretty quickly, we ought to have a pretty good idea of where we stand in early mid-February. And one of the first people I'll talk to is Kate. You know, I got to say, what can we do to make sure we keep our schools open, make sure that parents know their kids can be in the classroom safely, make sure our educators know they can be there safely? Do you think it's time that maybe we give a little local discretion in terms of the masks? First person I'll talk to is Kate about that.
So, I mean, because parents at home are asking you, what's the end date? Or what's the rough end date for when I can send my kid to class without a mask?
Well, most importantly, you can send your kid to school right now in class. You can do it safely. Look what happened around the rest of the country that would be on quarantine for weeks on end. If you want an exact metric of where I think a local school or local district can be when it comes to when they have the discretion on masks, I got to talk to all the different stakeholders on that, but I think we'd follow some CDC guidance in terms of maybe below average infection rates.
Can we talk to someone from the Bridgeport school district?
Yeah.
I think it's important to understand when you're talking a little bit about mask mandates is that there are children that you need to factor into the situation as well. So I may be a parent who says I do not want to send my child to school with a mask, And Kate may say, I want my child to wear a mask. Now, they come into the same classroom, they're sitting next to each other. As a child, I see my best friend without a mask on. My goal now is going to be, I'm going to take my mask off. Now, who is going to monitor whether that child is supposed to wear a mask all day and the reaction that that child's going to have to exhibit as a result of their teacher stopping lessons throughout the day to have them make sure that they put their mask on because their mom or dad would like them to have the mask on. So I think it becomes a lot trickier than just saying, let's lift the mask mandate or possibly leave it in local control, because you are factoring into which kids are then going to feel as if they're different because their parent wants them to wear a mask, and who's going to police that? Because I can't ask my principals, I can't ask my teachers and staff to start now policing masks based on parents' preference. So I think it's pretty much either an all or nothing. I think to the governor's point, it's a little premature. Believe me, and Eric and the BEA will tell you, I watch this very closely. I don't like wearing a mask, unfortunately, though, in a school building. I think when you're dealing with children that you need to take into account how they're going to behave when you do lift that mask mandate and how parents are going to react that do want the mask. So I think it's a tricky situation, and I think we're several months away. Usually the clean break is always the beginning or an end of a school year to introduce anything new. We've been going 2 years now with the mask. I think the natural end date to a mask and the start date without a mask would be the start of the new school year. I know there are parents across the state that would be extremely angry at hearing that, but you have to also factor into the considerations of the people that are working in the schools and the other kids that are attending school as well. So
So Mike, it sounds like if the governor gave you local control, or the legislature did, you would probably want to keep it to the end of the school year.
I think it's just a natural end, a beginning and end of a school year. We wouldn't start a new rule for governing students in terms of uniforms, for example. We wouldn't start or end that in the middle of a school year or 3/4 of a school year. So I think this has become part of the school year, unfortunately, because of COVID. But I think the natural end date and start without it would probably be the new school year and the end date this current school year. And I think that just protects everybody. We're here, we should get to here. You know, that's unfortunately the reality of the situation.
And a big kind of component of this is obviously safety measures that are in place to keep everyone safe. We saw a number of those today. One of the big things, obviously, is those at-home rapid test kits that have been distributed to school districts everywhere. How has that been kind of handled here within the district, you know, just to kind of get the school perspective on that, that you're getting, you know, an influx of all of these tests? How does that work? Because obviously that's a huge piece of the puzzle is testing.
Right, so initially on the first distribution, we didn't have enough to give to every child, so we prioritized those students that were exhibiting symptoms. On Friday, we did have enough after the second round of distribution from the state to be able to have every child leave on Friday with a test kit of 2 tests so that they can bring home and parents can utilize that as necessary.
Are you expecting another round of tests coming in?
From what I'm told, there are more to come, and at that time, we will probably do the same as we did this time. If it's enough to distribute to the entire school community, we will. If not, we will prioritize with folks. But I think we bought us enough time to get us at least out for another 2 weeks.
And how often would you like these kids to test if they have enough kids?
Well, it just becomes more of a challenge for our facilities folks and our school staff to get it out, but we'll welcome this until we can see that the infection rate is well below the 2-3% mark. I think that's probably a good idea. We did great up until right around Thanksgiving, but I think there's no secret. The correlation between the percentage rate dropping and the reopening of schools, I think, go hand in hand. These are safe places to be. Folks are here. Mitigation strategies are in place where they're not during the holiday break. So.
Any more on topics? We can move to MDT. You want to start off topics?
Yep, one question for the governor here is from Christine Stewart. You asked the latest legislation late Friday night to extend the public health and civil preparedness emergency. Do you think that hurt you politically?
if they continue the public health emergency, that means another $50 million of federal support. That's a lot of money we do not want to leave on the table. That's all we're asking the legislature to do there.
So Governor, I'll sort of follow up on Christine's question. If the legislature is going to codify these 11 orders into law, why do we still need an emergency?
You need the emergency because we get a fair amount of federal support in terms of SNAP benefits and in terms of congregate care, and with 100% FEMA reimbursement. We would lose those federal monies if the legislature decided to end the so-called emergency.
But I mean, you know, you've talked about at some point the emergency does have to end. I mean, I guess theoretically we could use that reasoning indefinitely. So at what point does the emergency end then?
I think more to the point, if you keep that emergency in place, we keep the federal support coming in. I think that's really important. If you have that narrow group of executive orders, I don't need to do any new executive orders, leave nothing we foresee. My hunch is we've got the legislature, John, in session at least for the next 120 days, so they would be able to take the lead, and we'd be able to work with them if we found there was an emergency, we needed another executive order, they would have to sign off on anything.
But is there, in your mind, sort of an end date to this? I mean, if February 15th is not it?
The end date for me is not calendar related. The end date to me is infection related. I thought we were really near the end of this thing back in November, and then, like Mike said, all of a sudden some good Omicron came, and it came up, like a tornado. I'd like to think that that's the last one of these. I think we're going to have a lot more clarity, by mid-spring. That if the trend lines continue where they ought to be, I think we'd be near the end of this thing.
One last one for me. You sent these 11 orders to the legislature. Let's say they reject one of them. Is there a chance that you would just override them in an emergency and reissue that executive order?
I hope not. I mean, I think we've got to work together. If they don't think that nurses at nursing homes should have to get a booster, let's talk about it before you simply reject that. My hunch is there'll be broad consensus on all of them. Perhaps masks, like Mike was saying, some communities want more discretion. Down in Florida, Alabama, they outlaw schools' ability to say, I'd like people to wear the mask a little bit longer. So we're going to have to find the right balance there.
Would you be open if they passed a law saying it's up to local control now on school masks?
Look, I would be open to it if the metrics said we can do that safely. And I think we're getting close to that. We're not there yet.
Now, can the legislature actually extend the emergency legally? Do they have that legal authority to do that?
Yeah, they do. I mean, they have the authority. They had the authority last January when they showed up as well to go over any one of those executive orders, modify it, change it, veto it. They didn't elect to do it then. We're reminding them now we need you to do it. Otherwise, on February 15th, they end. So I do need them to affirmatively step up and say thumbs up, thumbs down, or this is how I would adjust it.
But I want to be clear on this. If they come back and say, we'd rather just give school masking up to local control. If the metrics in your mind aren't there, would you veto that?
I think if we can do that safely, and the majority of the legislature on both sides of the aisle said it's the right thing to do, I'd follow their lead.
Even if the metrics weren't quite where you thought they should be?
No, if the metrics said it's dangerous, I would have a different point of view. But I think we could work on that consensually.
Okay.
Thanks, everybody.
Thank you.